Good afternoon, everyone. It's really nice to see you all here. Thank you so much for coming to our first live town hall in many, many months. I have a few things to talk about. I'm going to go through them first, and then we will have questions at the end. If you have any questions that come up or you need any answers, I'm happy to do that. We're also going to be showing this via our in-house TV channel at 5 o'clock, I think, today. So any of you that didn't get to join us live will be able to watch it on TV. So I'm going to start off with our least favorite topic, but it's the most important topic these days, and that's COVID-19. Just to update everyone, we have one positive team member from our home health department right now. She's home resting under the care of her physician. There were several residents that she had minimal contact with, but we do have them under self-quarantine for 14 days just to be sure. Just to talk a little bit about self-quarantine, there's a few instances which we would ask you to do that. First, obviously, if you have been in contact with a team member that has tested positive, we would let you know and we would ask you to quarantine for the 14 days. If you've been in the hospital for over 4 hours, we would ask when you come back that you would self-quarantine just in case. Or if you've traveled or been through an airport and you return back to the community, we would ask that you self-quarantine. Just to give you some examples of what happens when you self-quarantine here at Abbey Del Rey South, we will deliver your mail to you. We will pick up your trash so you don't have to go out to drop your trash off. We do put your housekeeping services on hold temporarily while you're in quarantine. Maintenance will come to your apartment or your garden home for an emergency situation. We will continue to deliver meals. Our home health nurse, Tootie, would call and check in and see how you're doing and see if you have any symptoms, if symptoms are developing. Then we would contact your doctor, and if indicated, we would provide you a test. We would have you tested here. We can come to your apartment or your garden home and test you. If there is a symptom or something that we feel is necessary to do, we would do that in conjunction with your doctor. So that's kind of the quarantine situation. I do want to ask everybody, whenever you have a team member or anybody come into your apartment, you need to keep your mask on. If your housekeeper's there, you should have your mask on. Even though she has her mask on, you should have yours. When you answer the door to get your meal, you really should have your mask on. I really feel very strongly about that, and I highly encourage you all. Sometimes some of our residents, I think, get a little comfortable, and maybe they have someone come in to remind them to, maybe take their medications or something, and they don't put their mask on. And that's where we run into a potential exposure. 99.9% of the time, if you have the mask on and the other person has a mask on, you're not going to have an exposure. So you really need to make sure you're wearing your mask. And occasionally I do see some people walking around the community with their mask down, not covering their nose, not covering their mouth. Very important. We have to wear the masks correctly or they're not going to do their job. So just a little commercial about masks. I really feel it's important that we all wear them, especially when someone's coming into your apartment. If you have any questions about that, we can certainly talk about it. The next topic I wanted to talk about is billing. It's been a challenging year for the billing department here at Abbey Del Rey South. We've been through quite a few team members, but we now have Robert Childers, who is our new community accountant. He's wonderful, he's experienced, he is very committed to working with us, and he's very excited to be here. I want to ask that people do not drop in to see him, that we work with appointments only. The problem is he's still in training and he's still working and he's still trying to get a handle on things, and when people just stop in, it disrupts his workflow. So it's important that if you need to see him in person, face to face, that you call and make an appointment, and he will be happy to meet with you. If you have a billing question, I do want to remind everybody that we have our centralized billing department that you can call. The number's on your bill. I know it has been a problem in the past. I know you have not gotten the answers and the help that you've needed in the past using the centralized billing department, but they have done a lot of things to change it and to make it better. So I ask that you please first call that billing office number. It's on the top of your bill. We have a biller, his name is Arthur, he's assigned to our community, and he will be able to at least get started with helping you. If you have to leave a message for him, please make sure that you leave your name and phone number. I know that's kind of a silly thing to say, but he's played several messages for me that the resident didn't leave their name and phone number, and there was no way for him to contact them. And then he gets people complaining that he doesn't return calls, but he doesn't have the information. So it's important that you leave all of your identifying information for him. I will say though, if you do call and you leave a message for billing and you don't get a call back within 24 hours, I need to know that. You need to let me know because I'm working with the home office to track customer service. So if there's something that's not right and it's taking too long for you to get your answer, please let me know so we can make any adjustments that we need to make. But it's really important that we go through the process. If you have an issue with a charge on your bill for food and beverage related, Christian is the one to talk to for that. He's the only one that can fix a food and beverage issue in the system. If you have problems with that, you need to let me know as well. If you have an insurance related issue related to maybe medical bills for the health center, you also need to talk to the home office billing department because we do not do the bills here on campus for the health center. They need to be addressed by the home office biller. Many times, I get asked the question, what do we pay the home office for? We pay them to do our billing. We pay them to manage our Medicare billing, our insurance billing. So we want to make sure that we're utilizing those services that they're providing. If there's a problem, you're not getting what you need, then you need to let me know, and I'm happy to look into it and to take care of any issues that I can for you. At the same time, like I said earlier, if you do need to see Robert because you need to talk face-to-face with somebody about your bill, that's fine. He can sit down with you, your residential living bill, that is. He can talk to you about that, but you need to have the appointment. Moving along, culinary. So Christian asked me to talk to you about a couple things. First one is a reminder that the dining room will be reopening December 11th. So please make sure to make your reservations on December 10th for that December 11th opening. Another reminder for residents, please do not come into the kitchen. We really need to leave the kitchen for employees only. Some people go right in and it's not appropriate. We don't have the proper infection control in place if you're going into that kitchen. We will be serving an early lunch meal on Christmas Day if anybody's interested. That will be by reservation only in the dining room, that is. You can come to the dining room Christmas Day. And I've also received some feedback about the dining room setup. I've been asked if we could please space the tables out a little more, and I think that's a good idea, so we're gonna do that to use the entire main dining room area for dining services. So when we do open up, you'll see that the tables will be a little more spaced apart. I think that was a really good suggestion. Okay, sales. We have a new area director of sales. Her name is Chantel Sinclair. She's going to be starting on Monday. We're very excited to have her. She has 22 years of working in senior living. She comes to us as a very successful salesperson working in high occupancy communities. We're very excited to have her. She's going to be overseeing Abbey Del Rey and Abbey Del Rey South. And she will also be selling. So she will be a selling leader, which we're really happy to have that. So she will start Monday, she will get some training, and once she gets settled in, we will have her meet with you all and have interactions with our residents at both communities. Holiday team member appreciation. I just want to let you know that next Tuesday, From 3 to 5 in the back parking lot over back behind the health center, we're gonna have a winter carnival for the team members. We're not having our typical party this year for the team members. We just can't have that many people in one space. So we're gonna do it outside. We're gonna have a food truck, a DJ, games, raffles, a dunk tank that Christians volunteered to be the donkey. So that should be fun. And it's gonna be nice. Hopefully the weather will be nice. It's supposed to be a high of 66 and a low of 50 on Tuesday. So that should be really nice. So that's what we're doing, if you're wondering what's going on in that back parking lot next Tuesday from 3 to 5. I'd like to bring Roberta Hyman up real quick. She has an announcement to make on the Team Member Appreciation Fund. This is a very exciting announcement.
Thank you. You did it. You really did it. You, the residents here, were generous in showing your appreciation.
Can't hear you.
Okay.
Just,
I'm sorry.
closer to you.
Okay. You, the residents here, were generous in showing your appreciation for the team members at Abbey Del Rey South. And for that, we indeed will have a very happy holiday. We're delighted to tell you that the total collected was $136,769, and our quota is $125,000. So we really, really did it. All of the monies collected will go to the team members. This year, we contacted families of the residents of the health center, and in turn, they expressed their gratitude for the care that the staff gives their loved ones by donating $4,000 to the fund. Truly a first, and we sincerely thank them. We again want to thank Jennifer, our executive director, and the department directors and the sales department for opting out of their participation in the collection. Lenore Brooks and I want to thank you for making the fund such a success and allowing all of us, the residents of Abbey Del Rey South, to show our appreciation to the team members in such a generous manner. Thank you.
Thank you. Excellent job. Thank you for all the hard work. It's not easy fundraising. That's not an easy task. I wanted to go ahead and open up the meeting. Does anyone have any questions that I can answer? Teresa and Max will be coming around with some microphones.
Jennifer, this relates to the coronavirus. I think that the job that's been done here is fantastic. People can't believe that we haven't had casualties. It's a true tribute to the way things have been managed. At the same time, I have a little puzzle.
Sure.
We're all going stir crazy, and I understand the decision to open the dining room. But according to my calculations, people at the table are sitting within 6 feet of one another, and unless they're putting food through their masks, they're really being exposed to one another. I would like to know the thinking behind the wisdom of having the dining room open, considering what I just mentioned.
Sure. The dining room, basically it's based on your comfort level because people need to get out. People need to socialize. People need to have interaction. This has been a really long time that we've been isolated, and I've been asked by multiple residents to open the dining room because they're comfortable. Now, you can go and sit at a table by yourself or you and your wife, and you don't have to have people sitting with you, and you are 6 feet away from the other table. If you choose to have 2 other people sit with you, of people that you feel comfortable with and you trust that they are doing the right thing, then that's your decision and that's your choice. Yes, you do have to take your mask off to eat and to drink, of course, but you do have to put your mask on if you walk around or if you go to the bathroom or if you're moving about in the dining room. It's up to you. People still go to restaurants, people still go out and do things. I can't keep everybody contained 100%, it's just not possible. And I feel to have a controlled environment is worth it for the people that are interested in doing that. But if you're not comfortable, by all means, don't come to the dining room. That's perfectly your choice. We'll get to everybody.
And you put Robert's telephone number on the community app? It's not there.
Okay, we'll take care of that. Not a problem. Robert, our new accountant, will put his number on the community, on the app. Mr. Damon has a question.
Not a question, but a comment. I am really bothered by the improper wearing of masks here. A lot of people not covering their nose. There's a couple of people walking around with their mouths uncovered. And an awful lot of people, they keep falling down. There are ways to tie little knots in the back of those loops to make them tighter. But wearing a mask, if you're not going to wear it properly, is not doing what we're supposed to do. And it really bothers me.
You're absolutely right. I agree. We need everybody to be on top of this with each other. We need to be reminding each other. I can't do it by myself, and Teresa and Max can't do it by themselves. If you see somebody that's not wearing their mask properly, gently say something to them. If their mask is ill-fitting, we can give them one of these disposables. We have them at the front desk, and we're happy to do that. And Max has some in his office as well. So please try to talk to each other. If you see someone that's not wearing their mask, just gently remind them to pull it up. But yes, if you don't wear your mask properly, or if you don't wash your cloth mask, you know, the cloth masks that you wear over and over again, those need to be washed from time to time as well. I mean, I think pretty routinely they should be washed. So we have to do these things so that we can keep each other safe and keep, you know, at least being able to walk about the community and keep our spread down as much as possible. But I do agree, we have way too many people walking around without their masks on properly. Yes?
Back to the culinary.
Yes.
We've been eating in the dining room the whole 3 weeks that they were open. And really, we felt we were far enough. Oh, closer. We felt that we were far enough away from the other tables and the people we were eating with. In fact, I was going to ask, is it possible that you'll be opening up more? It's so much nicer
I know.
in the dining room. But back on that same thing, people are hesitant about eating in the dining room, yet all of the functions that you have had in the breezeway, people are close when they are eating, especially things like wine and cheese. The masks are off almost all the time. People are very close to each other, and I think that that's way more dangerous than eating in the dining room.
I understand what you're saying, absolutely. At least outside, we have the breeze, and it is safer to be outside, you know, in a closer circumstances, but we are trying to keep the distance. It is very difficult. We'll put chairs out, we'll spread them out, and then people will drag them close together. It's an ongoing process. We're trying to figure this out, you know, because we don't want to stop outdoor activities. We feel like people need that, but it is, you know, something that we're constantly working to do better on. You know, we're not perfect by any means. We don't have it figured out by any means. This is new for all of us, but we are working on it. And thank you for your comment about the dining room. I think you have to do what you're comfortable doing. You know, if you're not comfortable coming to the dining room, don't come. But it is nice to have a break from those trays. You know, it's nice to have your food served straight from the kitchen to the table. Yes.
Jennifer, could you clarify something for me, please? The people that are quarantined were exposed to a team member that came up to put stockings on them. These team members are not being tested, so how, were they sick? Did they call in sick?
She actually was tested. She works she's a medical student, and she was tested through her school. So she did not have symptoms, but she was tested, and that's how she found out. That's the problem with this, is that you can not have symptoms, but you can be positive, and you can go around doing your thing and not know it. That's why you have to wear that mask, because you really need to treat everybody as if they have it. That's the only way that we're gonna keep ourselves as safe as we possibly can. But yes, we do test, team members are tested in the health center twice a week right now.
Yes.
We're doing that.
I understand that, but my housekeeper comes in, now she's not on top of me, but she does wear a mask. She's not tested, right?
She would be tested if she were to have symptoms, yes. We would
Okay,
test
she
her.
had symptoms.
Yes, yes.
And how about the, I'm just curious to where you draw the line.
We're not testing every team member.
I
We're
understand
not.
that.
They come in every morning through a screening area where they have their temperature taken. Actually, they have their temperature taken twice during their shift, and they're asked a series of questions. Whereas if they were to, and they're asked, you all have all been through them, I'm sure if you've been through the gate, they mention the different symptoms. And if they have any of those symptoms, we stop them at the gate and they're not allowed on property. They go home, we pay them, they don't lose the day of pay. We try to figure out then with their doctor what's going on. And sometimes people just have a cold, but still, we do stop them at the gate.
Okay, so the companions that come in through Tootie, are they tested?
Only if they were to have a symptom, if they
Okay.
were to have a problem.
All right, I
Yeah,
just,
yeah.
you know, my feeling is we need to test everybody.
I agree. It's a little difficult. I will tell you, we are working on a plan for the vaccine, which is very exciting. LifeSpace has ordered vaccines for all communities, all residents. We're not gonna get them all, of course, in the first round. They're gonna go to the health center, they're gonna go to the care staff in the health center first. But there's a very good possibility that at some point we will have vaccines here for all the residents, which is really exciting. Not mandatory, but highly, we highly recommend that you would get that if we had it. So more to come as we get more information on that, but that's the good news.
Thank you.
Any other questions or comments? Ms. Getz?
It's not like COVID. Several people come to me wanting to know why we can't have coffee 7 days a week. We're not working, so it's not a Monday through Friday thing, as most people are. We're here 7 days a week. Is there no reason why we can't have coffee from 9 to 11, or 9 to 12, or whatever it is every day?
I will certainly bring that up to Christian. I haven't had anybody bring that up, but sure, I don't have a problem with coffee. As long as we can have the staff, yeah, that's certainly fine with me.
Almost every Saturday and Sunday, I take them for a walk. There's someone asking at the desk for coffee.
Okay, not a problem. That's an easy one. Any other easy questions? I'll take those all day. Okay. Well, that's all we have then for today. Thank you so much for coming out. Thank you so much for being here. It's nice to see your faces. I miss you all. And take care and be safe. Thank you.